and others. All right. So just a couple words about workforce development and increasing the capacity of that workforce. So many of you have that, as I said, so we'll hear from you about what's in your plans. But just to mention that in the 2018 global review that we did, so this is 5 years ago, almost 6, we looked at we looked at the workforce capacity, and workforce development has named many different things in cancer plans. And about half of the cancer plans that we reviewed in that 2018 had strategies related directly to increasing the capacity. And usually that was things like training. Usually it was things like developing standards and guidelines for the workforce to use. So like treatment guidelines so that the care of cancer patients would be more standardized across the country. And often we saw in the global review things like having conferences and getting people who normally don't talk together in the workforce, healthcare providers, nurses, physicians, oncologists, those kinds of public health colleagues of ours that are maybe patient navigators. There are all sorts of different things that we think about when we think about workforce, and often in those plans that did mention building the capacity, there was attempts to get different groups together that normally don't talk to each other. In fact, think about last month when Patty Gravett did some mapping together. One of her strong recommendations is that you do get the workforce together, different people who normally don't talk together, to identify, if you remember, she graphed that out or plotted that out, because it's so important to identify gaps that maybe other people in the workforce don't see. So when you get both the prevention folks together as well as the treatment and caregivers together, they can look through the whole system and say, we have an issue here, and it can be problem solved by that wide range of workforce folks. So I think that's all I will say about the previous 2018 review. Just a reminder, I think some of you know about that we just completed a 2022 review of that same process of going through all of the cancer plans and or NCD plans throughout the globe, and also asked about workforce development again. And that way we're going to be able to compare and see if there's any growth focused on building the capacity. So it will be nice. That will probably come out in about a year, that paper. So with that, I would like to now really turn over the call to you all, and we'll walk through the questions that we asked you prior to the session. And the first one is, again, no slides are needed. We just want this to be an informal discussion, but we'll start with just each group. If we have, I'll have to kind of check to see who's on, but each of the country teams identifying one cancer-related workforce capacity implementation effort, something that is in your plan that you're working on to increase the capacity of the workforce in your country. So just 2 or 3 minutes, and then we'll go into those other questions that we asked. Okay, make sense? Hopefully it does.
It does.
All right, well, let's, okay, good. All right, so we'll go in order that's on the agenda, and we will start with Eswatini. And I don't know, do we have someone from Eswatini on?
We do.
Yes.
Colosili is not on, but we do.
Afternoon, can you hear me?
Yes, we can.
Oh, okay, good afternoon. I'm Dr. Sipesihle. So I'll be just taking you through 2 to 3 minutes. Sounds very short for Team Eswatini. But I think I would just like to start by saying that Eswatini, just like other African countries, faces a severe shortage of skilled and specialized cancer-related workforce in all areas of care. That is the diagnostic, preventative, treatment, and palliative workforce. So according to our National Cancer Control Plan 2019 to 2023, Strategic Objective 1, which seeks to improve the institutional and technical capacity for cancer prevention and control, one of the key initiatives was to improve the knowledge of cancer amongst individuals and also improve the skills of health personnel. So I think our main area of focus was actually on training and skills transfer on the already existing workforce. So to actually go through that, we did a training needs assessment, which was done to inform a training plan to improve the competency of our healthcare workers in cancer care. And also developed a curriculum for community and primary healthcare workers on cancer prevention, early detection, treatment, and palliative care developed and implemented. And so far, nurses and doctors, rural health motivators have been trained. And then we also initiated and facilitated internal and external training for candidates which were interested in oncology, and recruitment and training necessary personnel for the provision of chemotherapy and radiotherapy services. I think just to highlight, as part of the diagnostic workforce, we actually have trained our radiographers. They do CT scans and they do ultrasounds independent of radiology supervision. And then for biopsy sample collection, we are actually utilizing our medical officers who have been trained and work independently of surgeons. We also have, like, I think I will actually also mention that Eswatini just only has one oncologist. So the oncologist works with a team of medical officers who are now doing initiation, monitoring, and follow-up for cancer, for chemotherapy, to initiate patients on chemotherapy. And then we also have trained our pharmacists in chemo mixing, and they are currently providing the services. And on living beyond cancer, we've actually have collaborations with the hospice at home, who are actually now following up our patients at home in collaboration with rural healthcare motivators. So these are non-clinical staff who've actually been trained so that they can actually provide palliative care services to patients at home. And I think just one area that we still feel we need to focus more, it's the allied health professionals, which are our physiotherapists and occupational therapists, to actually get better understanding of contribution and more support to identify career development opportunities for upskilling for those cadres. And also the need for clinical social worker trainings, because in our settings, we actually don't have clinical social workers. So we do need to actually also empower our current social workers for them to actually gain skills in clinical social work so that we can improve. I'm not sure if I should also go further to the partnerships, or it's just the first part.
You mean the second question that we asked you, or
Yes.
let's see.
Yes.
Yeah, let's wait. We're going to have everybody kind of do an overview of what strategies they have in their cancer plan that they're working on. So,
Okay.
and then we'll come back to the other questions, but thank you. That was fabulous. And you've done a lot and also have identified things to work on, but that's great. What I maybe knew, but was reminded of, is that for the whole country of one oncologist, and that creates, I'm sure, many challenges as you have described, but you have a great way of bringing that oncologist many other people in their work sites. So thank you for sharing. Okay, let's move to Sierra Leone, and let's see, I'm looking to see who we have. Dr. Cisse, are you on? No. Do we have anyone from Sierra Leone?
I don't think so, Karen.
Okay, well, we'll come back.
Yeah.
Yeah, we'll come back possibly. Okay, Sri Lanka. And we have Dr. Siraj.
So yes, yeah.
Hi.
Thank you very much. Can you hear me? I am on the way to home, so I am on the way side. So I stopped the vehicle and talking. So the question is the availability of human resource for different aspects of cancer care. So we ourselves we looked at from prevention to palliative care. So both preventive or the field health services as well as curative health services are involved in cancer care activities from prevention, early detection, then diagnosis and treatment, mainly the curative or the hospital setup. Then the final one, the palliative care, both curative, the hospital setting and the field setting need to be involved. So there was a vacuum for the expansion of palliative care, because even though oncologists are joining with other clinicians to initiate palliative care services, there was not a nursing, dedicated nursing staff, designated nursing staff. So one of the initiative happened last year was first ever dedicated palliative care nursing training program was commenced. So now they have already completed 9 months of training, or 6 months full-time institutional training plus 6 months hospital training. So they are going to complete the training in this October. So after that, they will act as dedicated palliative care nurses. So they will be based at cancer centers. Initially, they will work on, because already a lot of palliative care initiatives are happening in the cancer setting. They will be work on cancer palliative care, but in addition to, they will be their services will be expanded to other palliative care for other services, other disease entities also. Because in our setting, nephrology, the chronic kidney disease of unknown origin is a huge problem in Sri Lanka. So already some of the trainees are involving chronic kidney disease palliative care. Then so many COPD patients are also available. So even though we looked at them as stakeholders or the service providers in cancer palliative care. So they actually speaking, their services will be expanded for non-cancer palliative care also in future. But it will be a major step appointing, commencing a post-basic diploma in palliative nursing. The first batch is currently undergoing. And so they will be taking the leadership with the consultant oncologist and the medical officers to initiate palliative care from link palliative care from hospital setting to the community setting. Community setting also, the public health nursing officers are available. So the linkage will be coordinated by this palliative care nursing officers. So it will be a one of the newest intervention happened last year and continuing for this year. So we identified that thing, but we need to consider other aspects of cancer care involving the public health staff as well as curative staff also. Yeah. Those are my initial inputs.
Thank you so much. Again, a lot of activity happening and plans, especially around palliative care. And I like, that you're integrating other diseases. These are trained people who don't have to just take care of cancer patients.
Yeah.
So that's really a smart way to leverage that training into other other diseases. Thank you so much.
Yeah,
Okay.
you're most welcome.
Really appreciate it. Yeah. Okay, so Uganda is up, and I see we have Nolan, Dr. Nolan. I'm just. Are you on? We can see you're off mute, but we can't hear you. Dr. Nolan, if you're speaking, we can't hear you.
Karen, I can send Dr. Nolan a message
Okay.
to see maybe he has the wrong input.
Okay. Thank you. Well, maybe we'll skip over Uganda for now and go to Zimbabwe. And I'm looking through. Okay, I think Dr. Kudzi is presenting for
Kudzai,
Zimbabwe.
yes.
Kudzai,
Yes. Hello, how are you? I hope you can hear me.
we can hear you well, and we can see you too. Thank you.
Thank you, thank you, thank you. So I'll be presenting for Zimbabwe, and I identified nurse training as one of our capacity building efforts. Our healthcare system is nurse based, and because we have centralization of cancer services in our two major cities, one of the greatest impacts of cancer control has been the development of the Oncology and Palliative Care Nurse Training Program, which is a post-basic training program, well, similar to intensive care or theater training. It's a one-year program which capacitates nurses who are working in the district to be able to offer cancer services. And these include cancer screening, like visual inspection with acetic acid, VIAC, for cervical cancer, as well as HPV DNA testing as well. So these are nurses who have been capacitated to do that. And lately, in the vein of palliative care, we have an exciting program that is ongoing of palliative care integration into the public health system. We had palliative care as a standalone service being offered by a unit called Island Hospice, and we have identified palliative care nurses to be trained as part of this palliative care integration. And one of the developments is that the nurses will be allowed to prescribe morphine, which will ensure that even patients in hard-to-reach areas have adequate pain control. And because these nurses are also able to deliver chemotherapy, this has enabled us to decentralize chemotherapy services. So patients in hard-to-reach areas will be able to get chemotherapy. And there are other efforts to decentralize services to create posts for oncologists in the provincial hospitals as well. And in the last minute, I think I'll give this time to Venus. She wanted to speak about private-public partnerships that are supporting training. Venus?
Venus, you're on mute.
Oh, sorry.
go.
Yes. Thank you, Dr. Makua. Thank you, everyone. Yes, I just wanted to add on to what Dr. Makua has spoken about. So for our oncology training program, we have a nurse training program. We have a partnership with St. Jude's where we have nurses, the first batch, I think the second one have been sent for 3-month training as attachments, and then they come back to use those skills in Zimbabwe. And they also those cohort of nurses have become the trainers at the nursing school. And also we have the private sector coming in terms of supporting the oncology training through, because at the end of their training, they actually have a graduation. So they support the graduation awards. So that encourages the nurses actually to excel in their training. Thank you. Those are the additions I wanted to make.
Thank you very much, Venus. Thank you.
Thank you to both of you. Again, very impressive. We can have a few question and answer time after everyone is done here. So we might, I'm looking to see if Zambia is on, and I don't think so. Is anyone from Zambia on?
I don't think so.
Okay, so thank you. And we didn't get anyone else from, who are we missing?
Sierra Leone. No, I
Sierra,
don't.
and I don't see anyone. Okay, well, let's move forward. And if they hop on, we can come back to them. So let's just pause for a minute here and see if anyone has any questions for any of the folks that presented what they're doing right now for their workforce.
And I'll just see, Dr. Nolob, can you hear us? Or can we hear you?
Calvin, were you able to connect with him?
Karen, yes, I sent Dr. Noel a message, but I had gotten no response as of yet, so he may have stepped away.
Okay. All right. Well, Dr. Nolob, if you regain sound or are able to speak and we can hear you, please let us know. So one thing I would ask Zimbabwe, I don't know if Dr. Makova or Venus, you want to chime in on this, but my question is, you know, a lot of emphasis on training your nurses and that workforce. Do you have, and I maybe know the question, but I'd also like to know if you're doing anything about it, or know the answer. Do you have an issue with the lack of nurses to be able to train? Like, you know, a shortage in nursing workforce throughout your country? And if so, are you doing anything to recruit nurses?
We would love to have more nurses, but by and large, we have already an established nursing training throughout the country. So all provincial hospitals are able to train the general nurses, and there are some districts that are training nurses as well. But the issue was on the specialized nurses. That's where we had a major shortage. And that's the drive that we are now training general nurses to become specialized oncology and palliative care nurses. And we do have an intake of about 20 students a year coming from the different districts and provinces. And the selection process actually ensures that the different regions of the country are represented, which enables the decentralization. So there are always candidates who take up this training. And as part of my responsibilities as well is we also offer them teaching when it comes to areas like chemotherapy and other specific areas in the clinical setting.
Okay, thanks. That makes sense. All right, any other questions for countries on what they're doing in this area? If not, Leslie, I'm gonna turn it over to you to ask our next couple questions.
Great. Thanks, everybody. That was really interesting to hear. And in some cases, updates around some of the priorities that you identified before the time that you're with us this last year and this year for the time in the ECHO. So the next question number 2 that's in the agenda that we wanted to ask is what potential or current challenges do you need to work through in terms of what you just described, and what are you planning to do to address those challenges? So I think we heard from Eswatini, as a matter of fact, earlier, a little bit about the challenges in terms of more assessment and training for allied professionals are needed. And I don't know if we can start, actually, Eswatini, you're to answer the next question, but I'm going to go ahead and ask you anyway, because we're missing Zambia at the moment. So any plans to how to address the lack of allied workers, allied healthcare professionals? And that question is for Eswatini.
Afternoon. Sorry for the delay. We are actually still consulting, but mainly with one of our partners who is Taiwan, to actually explore if we can actually send some of our occupational therapists and physiotherapists for them to have attachments in the cancer facilities, seeing that we are actually quite new. I think my facility is just a year old in cancer. So we still have a lot that we actually need to do as far as our current workforce is concerned. Thank you.
Thank you. I appreciate that. And happy to hear from anyone else if they have done any kind of training or capacity building for allied professionals, healthcare workers. That might be another solution to think about. Anyone have anything to share?
Well, in Zimbabwe, we have had some of our allied workers, particularly therapy radiographers, undergoing training programs in various parts of the African continent, like South Africa and Egypt. And these trainings have been supported by the IAEA, and that has enabled them to learn new radiotherapy techniques and be able to apply those back home in Zimbabwe. So that's an ongoing program, and these programs are periodically advertised. So at least our physicists and our therapy radiographers have access to some of the IAEA training programs on our continent.
Thank you. Thank you so much. And I'll just turn to you now to talk about, from Zimbabwe's perspective, current challenges that you need to work through to address some of the things that you described before, and any plans, what you can do to address those challenges.
I did mention that we are prioritizing nurse training and the upskilling of our registered general nurses to become oncology and palliative care trained. The current challenge we experience is that there's only one center that is training oncology nurses, which is at Perinatal Hospital, one of the central hospitals. So the decentralization of the oncology nurse training is something that is a work in progress, so that we're actually able to train more of these nurses from our pool of general nurses. So that's something that we hope to address going forward. And it would actually have to engage like our Nurses Council of Zimbabwe, and also getting support from the Ministry of Health and Childcare. And like Venus had mentioned, we also need more trainers, because most of the trainers are in the capital, Harare, and perhaps to incentivize them to go perhaps to the second cancer center south of the country to start a training program in that part of the country as well. So that's something that we feel would improve the number of specialist oncology and palliative care nurses in our setting.
Great, thank you. I think that's a great idea. Especially the Nurses Council, which I take it as like an association for nurses in your country.
Correct. Yes. Yes.
And Dr. Foxhall asked, have you considered using echo methods to extend training?
maybe I can come into that for that. So our training is actually practical based, like the bulk of the training is practical based. So the children's ward at Paringatwa is where the nurses are most of the time. So at the moment using ECHO would mean that they don't get that practical skill because it's intensive and mostly practical. Yeah.
Yeah, that makes
And
sense.
I also wanted to add a challenge, because now when we send nurses out, if they get an opportunity for fellowships, when they come in, the technologies they learn, the skills they learn, when they come in now, they can't apply that. So they shelve those skills. So I think one of the areas we're looking at is how do we bring up to speed the methodologies and the technologies that we use to provide cancer services, so that wherever someone is trained, when they come back, they're able to use those skills. Thank you.
Yeah. I'm sure that's a challenge for many countries as they send people off for training, but then you come back and you don't have either the technology, the equipment, or the center somewhere to do the type of services that they've been trained for. Absolutely, that's a big challenge. Any other thoughts about challenges that have been presented in ways to solve them before we move on? And I'm going to ask again if anyone from Uganda, Dr. Nolob, can you hear us? No, I'm sorry, that's too bad. We'll come back to you. And I know, Alfred, you are also on from Uganda. Can you hear us?
Yes, Leslie, I can hear you clearly.
Oh, wonderful. We've been trying to reach Nolob, who shows that he's on, but he can't hear us or we can't hear him. We're not sure which it is.
Okay. But I joined later. He joined earlier than me. Did he present the Ugandan workforce capacity implementation effort?
He did not. We've not been able to hear from him yet. So if you have anything to share, I'd be happy.
I can do that in 1-2 minutes.
Okay, great. Please go ahead.
Yes, in terms of the workforce capacity building effort, Uganda Cancer Institute, the Comprehensive Cancer Center here in Uganda, established oncology fellowships so that we are able to train our cancer specialists within the country, because we are now, the government has accepted our plan to open regional cancer centers. And therefore, those regional cancer centers will need oncologists. So we have got accreditation from the Medical Council here in Uganda to where they came and inspect our facilities and then authorize Uganda Cancer Institute to train some of the oncologists. Now we have 4 programs running. One is Pediatric Oncology Fellowship. Another one is Adult Oncology Fellowship. And then Radiation Oncology Fellowship. And then Gynecological Oncology Fellowship. So those are 4 fellowships. Previously, I've been training from Europe, US, South Korea, and then South Africa. So they're saying should at least do the training, some of them here, to reduce the cost of training these specialists abroad. For example, radiation oncology, they trained for 4 years in South Africa. That is from Stellenbosch University, and it's very expensive for us to afford training bigger number. You can afford maybe 1 or 2 in a year. Yes. And then at the same time, in our National Cancer Control Program plan, we have planned for kind of scaling some of the primary healthcare component of cancer control, like cancer awareness for the risk factors, prevention, early detection, like screening, and so on, should be done in the primary healthcare facilities. And therefore, we need also to prepare that workforce to support the National Cancer Center and the Regional Cancer Center. So since 2018, we are doing some training, but due to inadequate level of the funding, we are not able to go far, but we're doing something. We have a pilot that we can scale to cover other regions of the country. Those are the two interventions currently. And also to support, because we can train them, but the government say we don't have these cadres in our structure for employing them through the public service. So we work through the restructuring of the Uganda Cancer Institute, a human resource. So we have got new structure that was communicated by the Ministry of Public Service this year in March 2023. That had expanded the number of the human resource positions. But of course, they accepted it, but they said there's no money to recruit and fill. But for us, that's a starting point to have the positions accepted for recruitment, but the recruitment will be based on availability of funds to fill those vacant positions. Yeah, those are the three interventions to do with the human workforce for cancer control that I can share with you. And then diving straight away to the challenges, I mentioned some of them. Inadequate funding, you cannot train more. Currently, our class of fellowship class, normally 2 to 3 students from East Africa and West Africa. Many of them in Uganda, we have like, you normally have a quarter of that. So that number is still not enough to meet the demand for the proposed regional cancer centers. We have already 2 regional cancer centers open in the northern Uganda and then in the western Uganda. The one for the western Uganda has been working for the last 5 years, but has only 1 oncologist. The others are general level doctors. Here we call them medical officers. So we still need to do more. And then at the same time, to train these people well, because fellowship is like learning on job, the experts here who are training them at the same time, oncologists who are also inadequate in number, they're also seeing the cancer patients. So dividing their time between patient and then training these people is a big challenge. So you have few of them. This is why our enrollment normally 2 to 3 per class, 2 to 3 per class. Yes. That's what I can say. Dr. Noleb, are you able to hear what I'm saying? If you can add on.
We heard you very well. Thank you, Dr. Alfred. And I'm sorry, but we still can't hear from Noleb. Oh, we can come back.
His office is slightly away from me, but it's also in Uganda. It's time for going home. Maybe he's driving.
I know.
Maybe he's on the way.
Maybe.
Yeah, yes, yeah, maybe, yeah.
Well, thank you so much for jumping in and providing that overview and talking about the challenges. I wonder if anyone has any solutions. Funding is always an issue, so it's wonderful that you now have a structure to be able to establish those positions. But of course, if there's no funding to fill those positions, it doesn't help anyone. And also, of course, additional funding to support training in country for those fellows, or additional support to send them out of country to get the training that they need, when we know that you have so few oncologists available to do that. Does anyone have any solutions to offer up for Uganda?
This is always the biggest hurdle. How do you identify and obtain those resources? And, again, having positions approved but no funding to fill those positions is, I think, probably a common issue.
Well, we'll let everyone think about that. If you have a solution, we all want to know about it. And maybe we'll move now to that last question that we had in our agenda for you, which is, what partnerships do you have, will you need to implement the effort, and what will the role of that partner be? So, I mean, we heard from Zimbabwe about things like working with the Nurses Council to encourage support for training, and to encourage funding to be able to fill positions and increase capacity. And I don't know, Dr. Siraj, I know you're driving, but can we turn to you now to see if you want to share anything about partners that you're going to be working with?
Yeah, in now Sri Lankan setting, if I discuss about which I discussed previously about palliative care services. So, in addition to the Ministry of Health palliative care nursing team, the so-called civil society organizations involved in palliative care, Sri Lanka Cancer Society, and there are some other NGOs involved in palliative care. So these palliative care nurses in the cancer centers are communicating with these volunteer service providers also. So in addition to the public health staff, they work with these civil society organization nursing teams also when the extended palliative services are arranged in the community. Because in the field at the moment about 150 public health nursing officers are available. So when we consider 22 million population in Sri Lanka, that number is not adequate. So definitely need to involve civil society organization, volunteer staff also. So that's the strategy to patch up the deficiency at this moment. But with that also, we can't say that we can't say that entire country is covered in having the field palliative care services at this moment. So a lot more to be done.
Thank you. Thank you so much. Those are great solutions, though, to turn to your partners who are in Cancer Society or in civil society organizations, those NGOs. That's great.
Yeah.
Thank you.
Thank you. Thank you.
Yeah. And so any other folks on want to talk about partners that they intend to engage? I know we had asked Eswatini to talk about this as well. But anyone can share now. Other partners that you thought of that might be useful to work with to address some of these workforce development issues?
Okay, thank you. For Eswatini, we've actually currently engaging with the with the nursing training colleges to actually include a cancer module in their training. And then also we've coordinated with the Medical and Dental Council to allow our interns to actually have a rotation as well in cancer, so that they can be exposed to cancer patients and care. And then further, I think what we currently have as well as a partnership, it's a public-private partnership. I did mention that we do have radiographers who are actually doing CT scans in the absence of radiologists in the public setting. So we then send those scans to private practice to the private facilities for the radiologists who are there to then report for us. So it's been working very well for us, that partnership. But we are actually also hoping to explore by maybe sending some of our human resources for cancer to the private facilities, since most of them have the specialists, so that maybe we can actually have skills sharing as far as our staff is concerned with those facilities. Thank you.
Thank you very much. That's really encouraging to hear, and I'm glad that it is working out to have those radiologists do the reading and reporting for you. Great, thanks. Anyone else want to talk about any sort of private partners that you've worked with? Have you done something similar? I guess not so far. Okay. All right, I'm gonna check one more time on Nolab. Nolab, can you hear us? Okay, I just wanted to make sure. Any questions anyone has, or other things that you'd like to offer up that have worked particularly well for your country in terms of that you haven't had a chance to talk about yet, or questions that you haven't had a chance to ask yet?
Can you hear me?
Yes.
Yes. Well, I just wanted to speak to capacity building for our healthcare workforce, something that I had not mentioned, which is specific to medical practitioners, which was also identified in the cancer strategy as a potential area to improve capacity in our healthcare workforce, has been curriculum development, because we have in our medical training, oncology training is not really part of the main modules that are offered by our training institutions. So one of the recommendations was to include an oncology module, which will make the medical officers or general practitioners aware of the pertinent cancer issues, particularly the priority cancers in our setting, cervical, prostate, and breast cancer, so that the undergraduate training equips medical officers to be competent to diagnose and make necessary referrals for cancer patients. So I think curriculum development is one of those areas which was identified. And I think it will help medical practitioners to be more competent in the management of cancer patients.
Great, thank you. Was that easy to do to get that added to curriculum?
It's a work in progress, because one of the greatest challenge for implementing that would be the staff. We have at our University of Zimbabwe, we have 5 oncologists who working for the university. So they would then have to be giving lectures to maybe 300-400 medical students at a time. So I think the details are to be worked out, but the curriculum development is a work in progress to ensure that oncology training in the undergraduate curriculum is implemented.
Thank you. Thank you for sharing that. We appreciate it. That's helpful. And I think a really great solution for others as well. I just want to say that it looks like we had someone from Sierra Leone just join.
Yeah, Ronita and Venus has their hands up too, maybe to follow on.
Yes. So Ronita, I just want to say welcome, and Venus, please go ahead and ask a question or give a solution.
I think one of the solutions, though we are working on the curricular development, but to bridge the gap before that is absorbed and is functional, is looking at continuing education, providing continuing education for the professionals that are already in practice. So we have been working with the Harare Institute of Public Health and one of an ex-lecturer from the University of Zimbabwe to try and to actually develop a pharmacy curricula, oncology pharmacy curricula to target those cadres, so that before we get pre-service training, those in service actually with interest can actually train. And we've been working in partnership with the European Society of Oncology Pharmacy, because they already have that accredited training. So that's something we are trying to get the Pharmacists Council to actually approve. That's for the pharmacists. And then for allied professionals, we've got a partnership with Island Hospice, which offers palliative care training. So they've been training, so the palliative training is actually skewed towards oncology. So they've been training cadres, and they're the ones we've partnered for integration of palliative care in Zimbabwe. So we've done multidisciplinary training up to district level, but there is a component of oncology in all those trainings. So that's what we've been trying to do to bridge that gap. Thank you.
Thank you, Venus. That's really helpful. Thanks so much. And I think a great idea to think about continuing education, and really nice to capitalize on the work that pharmacists, I think, are already beginning to do in the country. And so, yeah, thank you for sharing that. And Dr. Foxhall adds that ASCO has developed curriculum similar to this for continuing education. Lewis, is that what it's for?
It's a primary education series that was actually Dr. Ernie Hawk and I developed for them a while back, but it's they provide it in various settings, but it's a multi-day seminar that they set up. But it's targeting sort of the primary care, general care sort of population, which sounds like what they were suggesting earlier. But anyway, I'm sure we could get that from Doug. And I think Ophira did the last one in Nepal. I wasn't able to go, but I think she did one there recently. So I'm sure we could likely get that, just see if it's something that helps address the challenges that we were talking about.
Great, thank you so much. Anyone else? Ronita, we see that you joined us. Anything you want to add about workforce development, training, capacity building?
Hi, I'm having problems with the internet. Can you hear me?
Yes, we can hear you.
Yeah, sorry, because I was in a workshop and then I literally have to dash along. So I was hoping that someone else would have logged in. So I'm only just logged in now, or trying to log in. Can you hear me?
Yes, we can hear you. Yes, sorry about that. No, I don't think we had anyone else join us. Maybe they were also having internet issues.
Okay, yeah. Okay, right, because we spoke yesterday. So I'm kind of all wobbly.
That's okay, and we can always follow up with you later if you.
Yes, and I'll listen to the recording. Apologies for that, but I just thought at least let me have last 10 minutes or something with you as I rush in.
That's okay. We'll be glad to have you see the recording, and then if there's anything you want to share from Sierra Leone, we're happy. We can share that through Basecamp or otherwise.
Yeah, and in fact, if you want to take the pre-session questions and just add some thoughts on what you're doing in Sierra Leone, you can fill out that questionnaire, that pre-session question form that we always send out, and get back to us with that.
So Karen, I'll turn it back to you to, I think, close this out at this point.
Yeah, hopefully you like this. It was so interesting and so informative to hear from everyone and have them describe what they're doing. So I hope you like this format. Give us some feedback about that if you liked having questions and specifically assigned to different teams. But I know from, I think, our perspective, it was really interesting to hear from everyone. So thank you for your participation and your pre-thought about those questions. Not much more to add, except for we do have our next session on the 27th of September, and that will be focused on research and supporting research through your plan implementation. So we'll talk about that, and maybe we'll do something a little similar to this, have some questions that are pre-assigned, and have folks think about that before the session. And with that, I think Clay or Calvin, do you want to bring up the there we go, post session. So thank you again. If you could please answer these questions for the post session poll. We always use your feedback to improve and to sometimes change our approach. So that would be great if you could.
And Nola, we see your note. Thank you so much. And we're sorry that you got pulled away for an emergency. So, but Alfred was able to provide some input on what's happening in Uganda with workforce training and development. Thank you.
All right, everyone. Well, oh, go ahead.
I'm sorry. And
Well, thank you
Louis,
very much.
Yes. Louis, do you know, is the ASCO, is that training that you talked about, is it available online?
I don't know. We can follow up with Doug Pyle, and Vanessa Eden is the program organizer that has helped set up these. So we'll check with them and see. I don't think it was originally designed for in-person presentation, but we can check with them and see. And people can take a look and see if that's kind of fits in with what they're interested in. And I can't make any promises for ASCO, but we can kind of see what the availability is either online or with direct presentations. But we can certainly find out.
Okay, we will find out, everyone, and get back to you. Great. Thanks, everybody.
Okay, with that, have a great rest of your day, and we'll see you in September. And again, thanks for your participation, and you can always be going to Basecamp to engage further in this discussion.
Thank you,
Thanks, everyone. Thank you.
Thanks again. Sorry for